Hi, my name's Drew Gallos, and I'm one of the assistants here at Foot and Ankle Surgical Associates. During this segment, I'm going to walk you through the opening procedures that we do every single day. As a back office assistant, you're going to be one of the first people that always arrives here, so you'll be unlocking the doors, turning on all the lights, and then hopefully following a handy how-to checklist that covers all the basics of opening for the day. Now typically you're going to arrive anywhere from 30 to 60 minutes before the first scheduled patient. In this time you will be prepping the rooms, setting up the rooms, stocking, prepping all the diagnostic tools, and a bunch of little odds and ends here and there. Now follow me.
Each room is set up identical to each other. Whether you're in the Centralia office or Tumwater office, you will find each room organized the same. This is to ensure an easy transition between office site and staff. You will need to be thorough and check each drawer, cabinet, and shelf to make certain you not only have each supply, but enough so you will not run out during the day. There will always be certain supplies that will be used more than others, and depending on the type of patients you see during the day, you may run out of additional supplies. That is why it is key that staff and physicians communicate with each other throughout the day. If you use the last one, tell the person in charge, or if you take something from another person's room, tell them so they know. Room stocking is an essential factor in the perfect assist stat you will be keeping. We will talk more about that later. Each room is specifically labeled so you will be able to see where supplies go, and we will briefly now go over the basic organization of the rooms. As mentioned above, each room is set up exactly the same way to help you maintain orientation while traveling from office to office. Near the sink you will find a case with many drawers. This case will house supplies such as band-aids, blades, creams, and ointments. Tape, pads, and small miscellaneous supplies will also be housed there. To either side of the case you will find your soap and hand sanitizer, as well as your gauze sponges, or 4x4s, Q-tips, both thick and thin, and the Dremel for nail care. You will also have located on the side of the case supportive materials and brochures, along with foot models to educate the patient. Above the case there are 4 cabinet doors, in which house more supplies. Behind the left 2 cabinet doors you will find prefabricated insoles in all sizes and post-procedural shoes. Behind the right 2 cabinet doors, you will find the majority of the supplies used in clinic. There are felt and foam for padding and adjusting orthotics in feet, Una's boots to help reduce swelling in the leg and foot, stockinette to serve in bandaging patients, as well as applying fiberglass casts and plaster splints, tube grip, which is a compressive stockinette that helps decrease swelling, phenol for nail procedures, cantharidin for wart removal, alcohol for sterilization, lotion for moisturization, ethyl chloride, a cold spray to help while giving injections. The injections themselves, hydrogen peroxide for wound cleaning, spray adhesive to help tape and bandaging stick, spray powder to assist in applying socks and stockings, as well as decrease friction in the shoe, air sanitizer to eliminate odors, iodine for bandaging and wound cleaning, sterile spray saline for cleaning, and any braces or other materials. On the side of the cabinets in Tumwater, and in the cabinet or on the counter in Centralia, there is mounted Cavi wipes. These are wipes used for cleaning and sterilizing equipment and the room. Below the counter is a series of 4 pull-out drawers. In the top drawer is where you will find the majority of your bandaging supplies and small items. You will find Coban, a self-adhesive wrap, also called vet wrapped, and it's used for bandaging. You will find iodine swab sticks for wound sterilization, culture swabs and specimen jars for collecting samples, Cling, a gauze type of wrap for bandaging, Steri-strips or butterflies for wound closing, Adaptic, a non-stick bandage to place over incisions, tuning fork, light, measuring tape, and shoehorn. The second drawer houses other bandaging supplies, such as Ace bandages, Webroll, which is a padding wrap for casting and splinting, protective eyewear for procedures, different samples that we use often in clinic, foot and ankle wrapping tape, Kerlix, which is a heavy-duty bandaging wrap, orthotic samples, various instruction handouts and notepads, sterile 4x4s, tube foaming for padding toes, and sterile gloves for procedures. The third drawer contains the drapes used in the clinic, such as the chucks and plastic drapes, as well as walking boot padding. To the right of the drawers and under the sink you will find all of your orthotic casting supplies, such as the plaster and the basin, as well as the sharps container for used blades and needles. You will need to ensure that each room is stocked with these supplies every morning during your opening procedures. Any supplies you've run out of can be refilled by going to the back stock room and finding the supply. With your room stocked and supplies at the ready, you are now ready to begin the second part of your opening procedures, which will be to draw up the most common types of injectables used in the office. It is crucial when drawing injectables that everything remains sterile. Any surface on the syringe or vial must be sterilized and remain so. The surface on the end of the syringe, where the needle attaches, must not be touched. Likewise, the surface on the needle to which the syringe attaches must remain untouched as well. Each vial must also be wiped down with an alcohol swipe and allowed to dry so as to decontaminate and sterilize the surface. The only thing that should touch the surface of the vial is the needle that will puncture it to draw the solution. If anything else touches the vial, it must be wiped again with alcohol to sterilize it. The first type of common injectable used in the office is the cortisone injection. This is often referred to as the pink injection because it contains a vitamin that is colored pink. This injection is used to treat chronic inflammation and is a mixture of 3 different solutions. When drawing an injection containing more than one solution, care must be taken so as not to cross-contaminate the 3 solutions. The rule of thumb when drawing the multiple vials is to begin with the least toxic vial first and end with the most toxic. When drawing the pink injection, the least toxic solution is the 0.25% Marcaine plain. The most toxic is the Celestone or cortisone. The third solution used in the cortisone injection is cyanocobalamin, which is a vitamin B12 solution. Although this truly is the least toxic solution of the 3, because it's colored pink, we draw it last. This being said, when drawing the cortisone injection, we begin with the 0.25% Marcaine. Plain refers to no epinephrine. You will draw 2 milliliters of this into a 3 milliliter syringe. After that, the next solution will be the cortisone itself. For cortisone, we use Celestone or betamethasone. The vials have a vacuum nature to them, creating a negative pressure, and when a syringe with solution in it is placed in the vial, it will tend to suck whatever is in the syringe. Being careful to firmly hold the drawing end of the syringe so as not to accidentally allow any of the solution to leak into the new solution, draw your 1 milliliters of Celestone. This should go right to the 3 milliliter mark. The final touches, as mentioned before, are going to be the vitamin B12. This helps to soothe the nerves when the cortisone is injected. Again, holding the drawing end of the injection tightly, place the needle in the vial and pull a very small amount into the syringe. 0.1 to 0.3 milliliters is all that is necessary. You have now drawn a cortisone or pink injection. Making sure to place all clean and sterile precautions we discussed earlier, draw the second type of injection. This is done using the same protocol, except it's a little easier because it's only one solution. This is called the clear or Marcaine injection. It's an analgesic or numbing injection and is used to numb the area of choice. It's a local anesthetic. This injection is created using a 5 milliliter syringe and a vial of 0.25% Marcaine plain. Again, plain refers to without epinephrine. You will place the needle in the syringe and draw 5 milliliters of Marcaine. After you have drawn your injections, it is important that you replace the needle that comes with the syringe, which is a 20 gauge needle, with one that is more acceptable for the patient. The lower the number, the bigger the needle. So although we use a 20 gauge to draw our injectables, we cannot use a 20 gauge on our patients, or they'll scream at us. For the pink injection, we use a 25 gauge needle. It's a 1.5 inch long needle. It's slightly larger than the 27 gauge needle that we use for the clear injection. This is because the cortisone has suspended particles that are bigger than a normal solution, and we need more room in the needle for those particles to pass through. To change the needle, carefully open the new needle. Do not touch the surface that will attach to the syringe or the needle itself. Hold it by the clear plastic protective covering. You will unscrew the 20 gauge needle from the syringe, being extra careful not to touch the end of the syringe on anything. Place the surface of the new needle against the syringe and screw the new needle into place. Injections are used frequently within the clinic, so it is important that you stock each room with enough injections to last the day. A rule of thumb is to place 4 of each injection, pink and clear, within each room. In the top right cupboard, you'll find a small white tray which will house these injections. Now that your injectables have been prepared, you can turn to instrument preparation. Each day we sterilize all of the clinical instruments. These sterilized instruments need to be wrapped and dispensed into each room during the morning procedures. These instruments are wrapped together in foot care packs. A foot care pack consists of a nail nipper, curette, and blade holder. Each room should be supplied with 3 to 4 foot care packs. As these packs are used throughout the day on patients, they will need to be transported to the dirty sterilization room to soak in a cleaning detergent and then be sterilized. To prepare these instruments to be put in the room, you will need to open a white napkin drape. There are 2 sides, the sheen, waterproof side, and a more cloth-like paper side. Place the drape on the counter with the cloth paper side down and the sheen side facing you. Place a nail nipper, curette, and blade holder in the middle, just under the center line. You will then fold each side on itself and roll the instruments. These instruments are now ready to be placed in the room. You will now prepare the room to see patients. Make sure each surface is wiped and cleaned using the Cavi wipes. You will then place the chair in the down and upright position so patients can easily climb into it. The counter is then prepared by placing a chucks down in front of the small supply case and to the left or right of the sink. 4x4s are then to be neatly placed vertically at the end farthest away from the sink. It will depend on the room whether it is on the left or right. As your patient's health is our #1 priority, anytime you touch supplies that will touch a patient, you are to put a new pair of gloves on. This goes for placing the 4x4s down and also making foot care packs. The final part of your opening procedures is to turn on the diagnostic, ultrasound, and x-ray machines so they can be warmed up and ready to go before the patients enter the office. In Tumwater, this is done by turning the green switch on the lower tray of the ultrasound machine to an on position and allowing the machine to warm up. The x-ray machine is digital, so all it's necessary is to make sure the power switch to the pad is turned on. This is found on the black electrical box attached to the cords coming from the pad itself. The wall unit is also switched to on, and the computer is turned on and logged into the radiograph software. The ultrasound machine in Centralia is different and needs only be turned on when a patient is ready to be seen. It may remain unplugged and off until taken into a patient room.